In the last about 10 years, there's been a huge increase in the amount of opioid use and opioid abuse and dependence. In addition, there's been a really stark increase in overdose related to opioid abuse.
So what do you think is contributing to this prescription pill problem in America?
So what happened was about 20 years ago, there was a big movement to make sure that pain was adequately treated. And I think everybody sort of believes that's really important. So pain became the fifth vital sign. And so that means that everybody was asked about their pain whenever they went to a healthcare setting.
Rank it 1 through 10.
Exactly, right. And so once everybody's asked about pain, you realize how many people are in pain. And then there was this need to then treat the pain. Well, opiates are incredible in terms of treating pain. And so what happened was, with this huge desire to treat people's pain, there were more and more opiate prescriptions written. And sort of now we find ourselves to the point where it's almost like no one's allowed to have pain because they're given medication very quickly, including opiates, to treat the pain.
So what type of education do doctors receive around addiction?
When I was in medical school 20 years ago, we had 1 hour of a seminar on addiction, and it was really about what happens at the cellular level in the brain. I mean, this is something that we feel very passionate about, and we really have developed curricula around teaching medical students and residents addiction. So we have a structured curriculum, but that is very different, I think, from most medical centers and most medical schools in this country. I mean, there's a lot of data that shows the doctors are really poorly trained in treating addiction. So it's no surprise that doctors then don't treat addiction because they don't know how to do it, they don't have the skills, they don't have the knowledge, and they don't have the confidence.
Recently, there's been some information that surfaced that white America's pill problem has gotten worse over the years. And when I was reading your studies, they said that there was some discrimination in the way that doctors were regulating the treatment programs that they were implementing. Can you talk a little bit about that discrimination?
The face of addiction has definitely changed over the last decade or so. And so I think the face of addiction that people sort of have in their mind is not necessarily what actually plays out in the world. And so we often see middle-aged white women with addiction to pills come in looking for treatment. And it's really important that they're treated in the same way that, for example, a heroin user is treated who might be male and younger and maybe a minority. And so we think it's really important to have very standardized practices. So, to get urine toxicologies on everybody, to have frequent visits with everybody, to recommend psychosocial support and counseling for everybody who needs it, regardless of gender, age, and race and ethnicity.
So if people are taking part in this 14-day sobriety challenge, what would you recommend to them if they're struggling with a prescription pill problem?
So the first thing I would say is they should talk to their doctor. In addition to that, one of the things they can do is take more of a harm reduction strategy. And that is to either reduce the dose that they're taking of their pills or reduce the frequency of their pills. But reducing harm can take the form of just using less pills or using it in a more controlled way. I'm Dr. Chinazo Cunningham. Instead of incarcerating people for their addiction, we should provide medical treatment.